Hey docs, Todd Warren here with Elevation Media. I know you've seen some of my videos in the past, but I want to cover today something that a lot of dentists don't like to talk about, and that is your sales cycle. And in this industry, we like to say, oh, this is healthcare, we really take care of people, we don't do sales. Well, you have a service that you want people to pay money for, so you actually do have a sales cycle. And this is probably what it looks like right now, where you're spending a certain amount of money generating leads. You bring them to your office through a phone call. That person that's on the other end of that line at your front desk, maybe it's your patient coordinator, treatment coordinator, their mission is to get that person's information and get them to show up for their consultation. And that's when you get to actually do what you do best, which is connect with the patient, discuss their options, present their treatment plan, and then comes the next difficult discussion, is the money talk, and then the person that they have to consult with before they can move forward with treatment. And the end result of this entire sales cycle is that nationwide, about 40% of people who inquire about your services or show up in your office are able to actually and do move forward with treatment. Now, if you're running any kind of marketing campaign that drives leads to your office for dental implants, there's a lot of bottlenecks in that, most likely. The first one being the actual quality of the lead. Now, what if you could get a lead that you've already qualified financially, you know if they're able to acquire financing, okay? What if you already know that whoever they need to consult with before moving forward with treatment has agreed to it or can show up to their consultation with them? What if you knew everything you needed to know about their treatment and why they wanted to move forward with dental implants? What if you knew all that at the beginning? Do you think it would make this person's job easier? Absolutely. Well, this person, even if you're doing a great job qualifying the leads on the front end, this person does not have the time to follow up with 200, 300 people every single month. And that, not to mention, they don't have the bandwidth to follow up with people 3, 4, 5, 6, 7 times on multiple different channels, whether that be phone, voicemail, text, email. They just can't do it. They're already being pulled in 10 different directions. So what we've done with this entire process right here, from lead to getting them to show up, is we've taken that on ourselves so your office can focus on the 900 things that they already have to focus on. And what we do when a lead comes in, we qualify them on the front end with all the things that I spoke about, and then we call them. Within 3 minutes of them requesting a consultation with you, we are on the phone with them. If they don't answer, we're leaving a voicemail. Once we leave a voicemail, we leave a text message, and we continue to follow up with that person and schedule them directly into your schedule so that your office doesn't have to worry about any of this. And in addition, we focus on getting them to show up. And if you run a marketing campaign for dental implants, you know that, no pun intended, but it's like pulling teeth trying to get marketing leads to show up for their consultation. And we have taken that on ourselves. You don't have to worry about it. That way, you're able to focus on the things that you do best, which is connecting personally with your patients, discussing what their options are, and then presenting their treatment plan to them. And this money talk becomes way, way easier because you've qualified them through your marketing on the front end of your funnel, which is what we do. This becomes a much easier discussion. You already know their financial situation, what they're able to do, if they need full financing, partial financing, if they're paying cash for treatment, and they already know how much it's going to cost because they've shared with us what they need in the way of, missing teeth, replacing missing teeth. So this discussion becomes so much more easier, and we've already inquired if this person can show up to their consultation with them, or if this person that they need to consult with has bought off on them moving forward with treatment. So removing all these barriers in your marketing funnel allows you, again, to focus on the things that you do best, because a lot of dentists don't want to market. And when you're able to focus on what you do best and let us focus on what we do best by taking the burden off of your practice in qualifying and following up with these leads, this number goes up. And if you're really good at case presentation, that could go up another 40%, another 50%, because you're getting qualified people in the chair in your consultations with you for those case presentations. Now, the other barrier to a system like this in your sales cycle is cost. So many marketing agencies want huge setup fees. They want huge retainers to be paid before you ever see results. And your hope is that, okay, I hope this really works because I just forked out a ton of cash. Now, with us, we're so confident with how this works and how well it works that we forego all of those costs on the front end. The only thing you pay is advertising on the front end. That cost goes directly to the advertiser, which is on the Facebook ad platform, which if you haven't seen any of my other videos, get a hold of me somehow on this page, message me on Facebook. I can shoot those videos to you to show why Facebook is such an amazing greenfield, untapped resource for dental implant patients who are going to move forward with treatment in the next 30 to 180 days. So we forego all of the front end costs of this. So the only thing you're paying for is advertising. And the only way we get paid is if you're successful. We get paid when people show up for their consultations, and we get paid when you collect on treatment. That's it. So there is no barrier to entry. If you have no money for advertising, this obviously won't work for you. If you have money for advertising, there's no barrier to entry. So if this is something you think might be a good fit for your office, we would love to get on a call with you to see if your office is a good fit for us to partner with, because we are going to be looking at your reviews online, seeing what patients are saying about you, because we want to promote the absolute best offices and the best treatment. We don't want the corporate structure. We don't want the corporate quality of dental work. We're looking for partners in private practice. So if this sounds like it's a good fit for you and you want to see if it's a good fit for the both of us, somewhere around this video, you're going to see a button where you can click and schedule a call with us, and we can go over what your goals are, what you want to achieve, and what it's going to take to get there with this process, and how we can, sort of lift the burden off you and your office of this type of campaign and just allow you to focus on what you do best. So go ahead, click the button somewhere around this video and schedule a call with us, and we look forward to talking to you soon. God bless.